everyone. I'm Dr. Carr, and my field is urogynecology and reconstructive pelvic surgery. My current practice is at South Shore Hospital in Weymouth, Massachusetts. Today, we're here with Jessica, who is someone with urinary incontinence, or UI for short. We're going to talk about her journey and perspectives about living with UI and how the use of technology has really assisted in managing her condition. Jessica, thank you so much for being here today. How are you?
Good, Dr. Carr. Thanks so much for having me.
Of course, this is such an important topic and we don't discuss it enough. So I'm really happy that you're here and that we can have a chat today. To get things started, I really would like to know, how did you first learn about UI and how did your symptoms present?
I first, I guess, would say developed UI symptoms in my mid-20s. I started to run and I started training for half marathons and marathons. And over time, I realized that I was leaking. And I kind of thought that maybe this happened to a lot of people, and I just didn't think about it. Um, but then it progressively got worse. I went to a urologist. This is, again, sort of 15 years ago. Um, I didn't know about pelvic floor therapy or anything like that. I went to a urologist. They did an ultrasound. They said everything looked good. And then I kind of went on my way, and the problem really never resolved itself over the next several years.
Oh, geez, what was your reaction to all of that? How did that make you feel, not living with this condition and not really having a solution?
Um, I was confused because I was like, is there something wrong with me, or is this expected to happen? Um, and then eventually it was inconvenience. But it was an inconveniencing thing. It was an embarrassing thing because you were kind of worried about leaking, and um, so yeah, it wasn't a fun thing to deal
No,
with.
no. And if it keeps you from your hobbies, your activities, and even just incontinence supplies can also be really expensive. And leakage can impact your day, make you feel embarrassed, just like you said. And I really am sad that it prevents people from living their best lives. So how did you do research, learn about the condition as a patient, and then how did you get care?
So it wasn't until a bunch of years later. Eventually, I slowed my running down because I wanted to start a family. Um, so then I kind of forgot about the running incontinence, and then it just became like new mother postpartum pelvic floor issues. And I had three kids over the course of the past 6 years. I pretty much struggled with um, incontinence, UI throughout my pregnancies. Obviously, it's kind of always happens, the baby squish in the bladder, but definitely postpartum. And then during those periods between children, I would go on YouTube and look for exercises to do on my own. There was one time that I did hire a pelvic floor therapist. She came to the house and she just kind of like adjusted me from like the outside and then gave me some exercises to do. But I tried to do them. I probably didn't do them as often as I needed to because nothing that I tried really worked. So I just kind of continued to be frustrated. So I didn't think that there was any other solution aside from pelvic floor therapy.
Who referred you to pelvic floor PT, or did you find it on your own?
I found it on my own, and this was when my daughter was born, so like 4 years ago, and through friends, some friends had made a recommendation.
Yep. And you're a busy mom. You have three kiddos at home. How
Mhm.
did participating in PT impact your life?
Well, I only did one session. So not that much, because basically she said, here are the exercises, do them on your own. So they didn't impact me because I really didn't do them on my own as long as I should have.
So compliance was maybe difficult, or it was a difficult program to follow. Did you think that it was because you're busy or you just didn't have accountability?
Yeah, I think it was because I was it was difficult for me to continue the consistency with the exercising with
Mm.
a newborn, like obviously.
That
And
makes
then I didn't realize this at the time, but I realize it now that I was not doing a contraction the correct way. So when I was trying and what I thought I was doing the correct way was actually not doing anything at all. So probably knowing me, I did it for maybe 2 weeks, didn't notice any results, got frustrated, and just kind of moved on.
wow. So who made the official diagnosis?
Um, Honestly, I never got an official diagnosis. What happened was I was at my 6 week postpartum OBGYN appointment
Mm.
with my last child. So that wasn't even that long ago. It was maybe
How old?
six. Yeah, he's about a year old now.
Yeah.
So I went there and I was sitting in the waiting room and they gave me some forms to fill out, which is standard. But one of the forms was about pelvic floor and leakage. And I was like, oh my God, like, what is this form? I've never seen a form like this before. This is awesome. Immediately, I thought it was awesome. So when I went into the doctor's office, the doctor, the woman, my OBG, I said, "Oh, I filled out this form on urinary incontinence and pelvic floor health. I'd never done a form like that before, and there's a product called Leva there." And she was like, "Oh yeah, a rep came by and told us about this product." And I was like, "All right, well, what is it?" I had no idea, and she kind of explained it to me, and I'm like, "Well, that kind of sounds freaking awesome. Like, it
Yeah.
sounds like
Super
like
excited, yes, to have some type of solution, maybe not
yes,
like recognition and then a solution. So that's really awesome.
yeah,
Yeah.
yeah."
Did you have any concerns about using Leva? Any like pause or hesitation?
No, actually, she told me I wasn't even sure if it was covered by insurance when she was explaining it to me, but I was like, I don't care, I'll look into it anyway. And then I looked into it and it was it was easy. It was a very easy process to kind of understand what it entailed, the time commitment, the cost, and all of that was really easy to digest.
What were the unique features that attracted you to Leva in the first place? It sounds like you were thrilled to just have something, a possibility that might address your pelvic floor issues. It wasn't even diagnosed as a pelvic floor issue. You kind of self-referred. But what features attracted you to Leva specifically?
Yeah, definitely the convenience of doing it in the privacy of your own home.
Mm.
Um, and what really drew me to it was the fact that the app accompanies the device. So you can actually see, like, you basically know that you're getting results. There's no way around it. You can see it. You can see over time how you're strengthening your pelvic floor. So I think knowing that I'd be able to track my progress in real time and being held accountable, because if I didn't do my 2 times a day, the lever rep would say, well,
Yep.
yeah, exactly. So I think those were the definite draws for me.
That's awesome. And that's often what I tell patients. Number one, you're a busy mom at that. So it's really a commitment to go weekly to pelvic floor PT. It's a little bit more invasive with the internal exams and different exercises they do there. And you really can do it on your own time. It's 2 minutes, 2.5 minutes in the morning, 2.5 minutes in the evening. But it's usually easy to carve out 2.5 minutes twice a day as opposed to a whole hour trying to find a babysitter or bringing the kids with you to PT. So I agree with you. I think that's an excellent feature, and I'm really glad we have this technology to offer to patients. In terms of the actual program or the treatment, um, when you're using it at home, how was it in terms of targeting those muscles? So you mentioned before you realized that, oh, I actually wasn't contracting the muscles the way I should have been. When did you realize that you were doing it correctly? And was that through Leva?
Yeah, it was definitely through Leva. Um, it was about 2 weeks. I I just was getting used to the device and used to the feeling of the contraction. And I remember when I kind of nailed it, I was like, all right, think to myself, like it took me like almost about 2 weeks, which means like no wonder why I was giving up when I when I didn't have Leva, because it's crazy. I was like, oh my God, these muscles probably have not been activated in, oh geez, 6 years. Like how old is my oldest child? So it was almost like finding like it was like a new muscle that I didn't even know was there. So that's why it took so much time to engage. And then once I was able to engage it, um, and I definitely noticed that difference, every other week, getting stronger.
Awesome. Did you have to interact with the support team at all? I've heard they do really good, like customer service. If you have any issues with the app, they're available. Did you run into any of those issues?
Yeah, no issues with the app.
Great.
The Leva representatives were awesome. I think at first we had an introduction call and then they would check in by text, which I thought was really great. Leva, unfortunately, is not covered by insurance.
Well, I do have some good news for those of you watching. Leva is now covered by some insurances. So the company has done a really good job at trying to expand access to this device. So it definitely is covered by some insurances, not all. And they do a great job from my office perspective in doing prior authorizations and coding things appropriately to try to get it covered for patients. I also believe that you're able to use health savings account dollars for this, which is really nice too. But definitely the health insurance, they're expanding coverage. So I get really excited when patients have it covered. And if they don't, I also try to put it in terms of perspective, weekly PT, even though your insurance covers it, you do have to pay co-pays. And it's usually a 12-week course. So 12 weeks of co-pays versus, or maybe even longer, versus the cost of the Leva device, which can vary. So, and everyone's different and, has different situations. So I do understand that. I always preface, I'm not here to make you spend a ton of money. But it is a really nice device in terms of compliance and the actual technology itself.